Hello, my name is Dr. Bayan. I'm consultant in pain medicine and anesthesia at University Hospital Leicester NHS Trust, United Kingdom. Today we're going to talk about cervical medial branch blocks using ultrasound. In order to perform these blocks, the ergonomics is very important. I have a patient laying on the side and facing towards me. I have the ultrasound machine focusing on the opposite side, and my approach to these blocks is outer plane. You could perform an in plane, which is a Korean technique that has been described, but outer plane going from anterior to posterior. The reason I prefer going from anterior to posterior, because then you can avoid the important structures like vertebral artery and cervical nerve roots. In order to scan the cervical medial branches, you need to look at the bony silhouette, which gives a wavy pattern onto the ultrasound. Now, I'm going to show you two wavy patterns, and it's very important to appreciate these two wavy patterns. We start medial to the sternocleidomastoid muscle, and you can see this wavy pattern has been described, but basically this is not the cervical facet joint line or the articular pillar. It's the cervical vertebrae, and as you could see, that's a disc. So please do not perform the injection at this level because you're way anterior, and you can see the vessel. That's your internal carotid artery. Now I'm going to move my probe posteriorly, and as you could see onto the screen, these are your transverse processes that you're seeing, and you also see the vertebral artery. And can you please put the color Doppler on? Fantastic. As you could see, the vertebral artery. And now take the color Doppler off. And now I'm going to move more posteriorly. Can we reduce the gain, please? Brightness, reduce it, please. Thank you. So once you've seen the vertebral artery, you're moving the probe posteriorly in order to get another wavy line, and as you could see it on the screen, you're getting another wavy line, and that's actually a true articular pillar view where you see the peaks and the troughs, and this is where you will perform the cervical medial branch. Now the reason to show the anterior wavy line was to make people aware that it's a danger territory, it's a tiger territory, and you do not want to perform the injection at that level. The other way to scan the cervical medial branches is putting your probe just behind the mastoid process. Now, other thing to appreciate is the cervical spine is not a straight structure, it's a curved structure. You have a cervical spine which has got lordosis, so you need to tilt your probe based on the lordosis of the lumbar spine. So we start at this mastoid process, and we're going to move down, and you can see the first joint, as you could see in this image, is a C2, C3 joint, and at the top of the hill will be your third occipital nerve. Now I'm going to adjust my probe in order to see more wavy line. As you could see, the peaks and troughs being demonstrated here. So just trying to get it much more angulated in a better way, and the peaks and troughs are much more better demonstrated here. So in the peaks and troughs, you have the medial branch located in the trough, and the peak is your cervical facet joint. So if you want to perform the cervical facet joint injections, you will bring the needle outer plane onto there, and if you want to perform the cervical medial branch, it will be in the trough, and you will lift off the splenius capitis muscle, and it's usually about half ml of local anesthetic, and I use a 25 gauge needle to perform this block. Thank you.